The state of Nebraska used to have the highest rate of Medicaid reimbursement for an autism therapy called Applied Behavior Analysis, or ABA. This program is credited with giving children with autism the ability to live normally. But back in August, the Nebraska Department of Health and Human Services decreased their reimbursement rates for families on Medicaid by almost half, meaning that doctors won't get paid as much for their services. And now experts are warning that this rapid shift could lead to treatment centers closing and doctors leaving the state. Here's my investigation.
A lot of times with autistic kids, parents don't really know what to do.
Meet Cassandra Anders and her son, Milo.
I like everybody.
You like everybody?
I like everybody.
Milo is on the autism spectrum and was diagnosed at a very young age.
He was diagnosed when pretty much right after he turned 3, he was diagnosed in September. It took a little bit to get him a diagnosis. There's kind of a lot of hoops that you have to jump through.
Anders has 5 children, and her family relies on Medicaid for Milo's treatment so that he can live a normal life.
Without Medicaid, I don't think that we could have been able to access that at all.
Medicaid pays doctors a percentage of what it costs to treat children like Milo in order for him to receive that care. But
then on August 1st, Nebraska DHHS reduced those rates by 48% for our drug therapy.
Meaning that doctors are now paid less than half a dollar for every dollar they charge on a service. And with that, providers and patients are left scrambling. Nebraska originally raised reimbursement rates to combat a crisis, a lack of care for autistic children, especially in rural areas. But costs for care rose astronomically after the pandemic. Autism care centers like Lighthouse Autism Center in Kearney are now concerned that reduced reimbursement rates will mean they can't afford to operate in a rural area.
We already are seeing rural Nebraska, as a general rule, be super underserved. And so there's a need to bring more people into those communities that are lacking services already, and with service providers exiting where there's already an absence of service providers, that just leaves them with more scarcity than there already was.
The Nebraska legislature was briefed on the issue, with Senator Dan Quick of Grand Island now worried about whether or not children on the spectrum can get the care they need.
And then there's also the Medicaid reimbursement rate, which is, in my opinion, is low already for health care, for developmental disabilities, and all those other areas. So cutting those rates isn't always the answer. I just want to make sure that we don't see a loss or a lack of services to children who are receiving ABA services.
With doctors getting paid less for their services, many worry that this could lead to autism centers no longer accepting Medicaid, or even worse, closing their doors.
My biggest fear is that families are going to have additional barriers and really an absence of support for where to go. And so that's one of the things we're trying to eliminate from those families.
And we always have those worries, even for just rural healthcare in general, that the services aren't as good as in, a community like Grand Island or Lincoln or Omaha, where they have more resources. What we're worried about is that loss of services with the provider rate cuts. Maybe the facility has to close, or they can't have as many employees because they have to reduce their wages that they're paid.
The Department of Health and Human Services says that if a center has agreed to accept their rates, service should not be impacted. A spokesperson for the department said that, quote, those services will continue to be paid through Medicaid. Medicaid-enrolled providers agree to accept Medicaid payment as payment in full and are not allowed to bill the patient. DHHS is committed to continuing this important service to Nebraska families. The Department of Health and Human Services requested State Auditor Mike Foley to make sure that their cuts were sound, and Foley said he thinks the cuts were a good start.
Just a few years ago, 4 years ago, the cost to serve these children was $4.6 million. Now it's running close to $83 million just in 4 years. And where's that going to go in the future?
Foley did say they uncovered excess spending with double billing, as well as people claiming to be certified providers even if they aren't. Foley added, though, that while his office is behind the cuts, he worries that a decrease this big and this quickly could have unintended consequences.
We'll have to take a look at this another year and just see what the impact is of those new rates. And looking in particular whether or not some of these service providers just drop out, saying we've cut the rate so much, I don't want to play anymore. I don't know if that's going to happen. I can't predict that.
This is where Cassandra and Milo come in. Medicaid provided the ability for Milo to learn how to be a child at Lighthouse Autism Center.
He worked on everything from his social emotional development to learning how school was going to be. It was always just they have paras, or they just go to a different classroom. And I feel like that harms a lot of people with autism, because then they're just shoved in their own room, separated from other students and things like that, because they didn't have the skills to be around neurotypical kids or being around large groups of kids.
Milo graduated from Lighthouse a few months ago, but the organization still does things to help him, like assist in getting an IEP. And Anders worries that if funds to services are cut, that could hurt children like Milo.
If those centers aren't accessible, I feel like a big thing is we're going to have issues diagnosing people with autism, or people are going to have to figure out a way to travel further just to get their child diagnosed. And also I feel like there's going to be a lot of setbacks, and it's kind of just there's constant barriers.
While reimbursement cuts now bring Nebraska into line with surrounding states, the question is whether or not those rates are sustainable for Nebraska, and whether or not Nebraska children will lose access to services. Reporting in Kearney, Ian Mason, Local 4 News. Lighthouse says they will still be opening a new autism center in Grand Island in the coming weeks, and that they're pushing forward to make sure kids on the spectrum get the care that they need.